I came here to attend her session because I just thought कि आरती so expert थी ड्रिवन की मार्केट ऊपर जाएगा तो हम खुश होंगे, मार्केट नीचे आएगा तो हम भी बहुत दुखी हो जाएंगे. Don't we have our own anchor? ठीक है. So वही figure out कर रहा था कि what will man talk about? Whether she will talk about building our own anchor so that हमको थोड़ी stability मिले or finding our own anchor maybe it's within us, we don't know. So ma'am, like millions of people, there are millions of views on YouTube as well. She's a TEDx speaker. She has 20 plus years of clinical experience. She is one of the most known speaker and of when she empowering women. She is a gynecologist. So with that introduction, we welcome you, ma'am, and the stage is yours. Thank you.
Thank you. What's your name?
My name is Sumit.
Sumit. Thank you, Sumit, for those kind words. Now, very, very good evening to all of you. Okay, I'm not a teacher. Good morning, good evening, miss. Sort of a response. So, I am a gynecologist. Now, all of you are wondering what is a gynecologist going to do? What is a gynecologist going to tell us about our lives? And the first disclaimer that I would talk about is I have zero knowledge about finance. Zero. Okay. So I'm in fact negative knowledge about finance and how to manage my finances. I've outsourced it to someone and I'm trusting them. So the reason why I'm here is I carry a story of my life. It started right now. I'm a director in the Department of the Obs and Gynae in one of the most prominent hospital in south of Bombay. But it started with a very small town in West Bengal. So that journey has a number of stories. That journey also has a lot of negatives, but a huge lot of positives as well. So a little bit of negatives in terms of I was born almost 1/4 blind through one of the eyes. But that never stopped my parents from giving me the best education and me from doing anything that I wanted so far. I lost my father when I was just 21. But still, and 1 year after that, my mother almost gave up on life and I was the only child there present. So studying in the 4th year of my medicine, and I had to almost put one foot on the college town and one foot in my hometown to take care of my mother as well as my studies. In spite of having a brilliant academic record throughout my school and college, I flunked a UK exam twice, not once, twice. I failed in the exam, once in theory, once in practicals. And I was out of job for almost 1.5 years when I was in UK. I didn't find a job. They wouldn't give me a job in spite of having a brilliant career here. So these are the negatives. Now the positives, I had wonderful parents, like extremely strong mother, and my father had great values. Just 10 years, maybe 12 to 22 is what I could imbibe whatever I could from my father, and those values are the ones which I still carry forward. I have a wonderful, supportive husband, lovely 2 children, not babies anymore, 24 and 18. I have a brilliant career and I've achieved more or less all the check boxes that I had ticked for myself. So this journey has a number of stories, out of which I have picked up 3 stories which I'm going to share with you, which has deeply taught me. Beginning with the first story, it was a few years back that I was, it was a Saturday. And Saturday I have, like, let's say half a day. Half a day means I finish my consulting by 6 o'clock. I do not stretch it over to 10 o'clock. I finished my consulting to 6 o'clock. At 6 o'clock, and I was supposed to join my family who was in Mother Island with my friends, and I was supposed to go there, and I went. So this was the story that I went to Mud Island, and I reached there by about 9 o'clock and almost just freshen up and had a glass of wine also. And then at 11 o'clock a distressed call comes from my hospital. Now when we leave hospital, when any consultant leaves hospital, we assign someone else also to take care of our patients, so that the patients never get hampered, their care never gets hampered. So I had asked one of my senior colleagues to be there, but still the phone call came to me that a patient has come from Karjat, and she's just a 22-year-old woman who has given birth to one baby girl 24 hours back, and she's here with complete failure of every organ. She didn't pee for 14 hours, so kidney completely failed. She's bleeding from everywhere, liver completely failed, the blood clotting factors completely failed, and she was all of 22. So this was when I asked them that I have assigned a senior colleague of mine. Why isn't he taking care of her? So they said that there's a truck full of people, and that actually the CEO of the hospital called. There's a truck full of people from Karjat, and we are fearing that if anything, because this woman is not going to make it. But if anything happens without you, because they have asked your name, they have come with your name, and if you're not there, then we would not be able to manage the mob, will not be able to manage the crowd. So please come and manage the situation. He didn't say that manage the patient, because for all of us, the patient was dead. Mentally, she was dead. So fortunately I had my driver, so I took my driver, and as I was coming from Mud Island, in those 2 hours, I took only 2 hours to reach the hospital. In those 2 hours, I was only talking to colleagues and brainstorming how would I write my dead information. Like, what did I see? What couldn't I do to prevent? Because she has come in such a bad shape that there was hardly anything to do. And how would I face the father? How would I face the parents? How would I face the family and tell them that, there's very little, you have come in my name, but there's very, very little that I can do for you. And as I was entering the hospital, every time I tell this story, I get emotional. As I was entering the hospital, there's a passage. And as I entered the passage, the first thing I saw was 2 grandmothers struggling to take care of that 1-day-old baby. It was like she was crying. They were trying to give her milk. They were trying to hold her, pat her. She wouldn't. Absolutely, she's going on crying. 5 steps into that hospital and seeing that scene, I just had to stop myself. I gave a pause and completely shifted my mindset to say that I have to do everything that I have, everything that I can to give this 1-day-old baby back her mother. So that was the shift in the mentality that I had, and whoever colleagues I was talking to, how to give their piece of information that we couldn't do anything, I called them one by one, and they were all in the hospital by 2 o'clock. We had a meeting. I said, I'm going to do everything. Just give me the ways. I have to give this baby, the mother, back. She was ventilated. She was all yellow, means, yellow sari, that way. The bilirubin was 21. The bilirubin is supposed to be 1. So we had almost no hopes, but we just fought From 2 o'clock to 4 o'clock, we had a meeting of how to support her. We supported her with almost, in those 3 hours, 3 to 4 hours, we supported her with 21 blood packets and blood factor packets. And 7 o'clock, we opened her up with a team of surgeons. I opened her up again. We found the bleeding point. We could clip the bleeding point. And as soon as we clipped the bleeding point, in 5 minutes, a drop of urine came out in the catheter. And you wouldn't, this is something which you will not realize what it is, but the whole OT almost clapped, because at least one organ we could save. One organ has started functioning. Age was in her favor, so one organ started functioning. Slowly she was, recovering. She had dialysis for almost 20 days. Then she was in ICU for about 26 days. Finally, she came to the ward and she went back home 6 weeks later. So what this story taught me was attitude is your outcome defining moment. If you have an attitude of losing it, you're going to lose it. So that shift of my mindset of completely giving up hope on that 22-year-old was changed by that 1-day-old baby. And because of the attitude, my action changed, my goal changed, my entire commitment changed. And that's the success of this story. If I did not change my attitude, I wouldn't have saved this. Now this has been 5 years now. She's again had a second baby with me, and this was the Ganpati time. So her whole family calls me up every Ganpati after that. So this is the story. I learned a lot in terms of dealing with a situation when you have almost everything to lose. This is, of course, a story of my own journey. I'm very passionate about giving the best to my patients, to my women. When I came back from the UK, I always felt that this is what our women in India cannot get it. So let me bring it. So we have got a lot of things from there. And so I always wanted to be a great surgeon, and I was doing a lot of laparoscopic surgeries. But this robotic surgery was new. 2012, I came back from UK in 2008, and 2012, the robot came in the world, like they were starting to do robotic surgeries, and by 2015, it came in India. So I was very, very keen. In all these years, I was looking out how do I upskill myself and things like that. So 2015 when the robo came here, I almost begged from every hospital to give me a permission to go and train. However, because there were very few hospitals who had robos, and there were a number of specialties where robot, like urology, like oncology, like cancer surgery or neurosurgery, where this is established, the hospital didn't want to take a chance in gynecology, because gynecology is not something which they thought the robot will do well. But I begged, and finally I got a letter I went to Belgium. 2016, I'm on the other side of the 50s, later 50s, so I wasn't young at that point of time. But I still went to Belgium. The course was for about 10 days, but I stayed there for a month, sacrificing my family, sacrificing my practice, because we are daily wage earners. If we don't work for one day, we don't get paid. So I sacrificed that practice for almost 30 days, and I got myself trained. And then when I came back here, I was a lot of hopes that I would give this advantage to my patients, and it will be taken care of and things like that. but there were no takers. The insurance people completely said that we are not going to support robotic at all because you can do it laparoscopically. I said, we can do it laparoscopically, but we can give this advantage of this precision surgery. And it was still very, very difficult. In fact, I steered a meeting with all my colleagues and went to the insurance companies to talk about that how can we make the insurance companies believe that this is a very, very high precision surgery. And in that, out of the 10 colleagues that we went, one colleague started completely talking about laparoscopy and against robotic. Not in my control. You know, we were just looking at him and, you know, I could see all the efforts that I put to spearhead this meeting is completely going down the drain. The insurance people were very, very, you know, they were happy that there was someone who understood that you don't need a robo to do the surgeries and you can give the same thing with laparoscopy. So you have setbacks like that. Then finally, in almost from 2016 to 2022, the journey was very, very slow, and I did hardly about 50 cases robotic where it was needed. And then in 2022, a young doctor came who believed in the robo, and we went together to the hospital again and said that from 2016 things have changed and let's get a new robo, and we convinced again the hospital to get the new robo for us. And from 2022 to now we have done like more than 600 surgeries together. So that's where I feel that holding on to your why, if you have a reason good enough for yourself, please hold on to that. That goal should not shift. I wanted to give this advantage to the women I am caring for. I wanted to give them the advantage of the precision surgery in very, very complex situations where the traditional laparoscopy could not give me whatever I wanted to achieve for my patients. But that was my why, and I stuck to it when I got trained. If I had, I got retrained in 2023 in the new machine, in the new robo. Had I thought, because my colleagues, all who were training with me, were like about 15 years younger to me. So if I thought that I wouldn't learn and I had the head held high above them, that I am never going to learn from juniors, I would be wrong. So there is a learning from everyone, even negative learning. People who are negative with you will teach you what not to do and what not to imbibe, what not to progress with. So both negatives and positives can accelerate your growth. And of course, don't quit early. I could have quit, but 2022 I was such a slow curve, and there were no support from everyone. If I stopped at that, I wouldn't have probably reached now the where I am, where people are coming to me only to do robotics because they know that she is the person who can do a good job. For the people, of course, there are a handful of us now, but again, a handful. We want to go with more. We want the patients to take the advantage, but this is how you can get over the things which are not in your control. So my colleague going over there and talking completely something which is off the radar is not in my control. So some things, when external forces, like she was talking about the external forces, like you people are engaging in different times, when you know that there is a time when it will be fine. In good times you think that prepare yourself for the worst times, prepare yourself for the bad times. But when the bad time comes, always remember, going on doing your job towards your goal will actually help you tide over the bad times, because the good times will come. And your second, as I said, my second innings were stronger with the more clarity that I got, with the support that I got, and so can you. Right, the third and the last story is about my son. It was again about 9:30 in the night when my son was studying in IIM Rohtak. He's 22-year-old. He was 22-year-old at that point of time. And he was studying in IIM Rohtak. And a phone call came. I was, post our dinner, I was just sitting and relaxing. And the phone call came to my husband. And I could see some frowns in his face. And I just spoke to him. And it took me a few minutes to understand that this is not something which I think I should ask him. And I said, who's calling? Is it about our son? Is it about Rishi? Rishi is the name of my son. So is it about Rishi? So he said yes. So he put the thing on the phone and then he said, Rishi had an accident. So I said, give the phone to me. So I took the phone. There was the friend on the other side, his friend on the other side, who was telling me, sobbing and telling me, Auntie, Rebanto is the good name. We Bengalis have a queer habit of having two names, one a house name and one an office name, a school name. So Rebanto is his school name. So he was telling me, the friend, that Auntie Rebanto had an accident. So I said, why are you crying? He said, Auntie, he's bleeding very badly and pink froth is coming out from his mouth, and I've never seen such a thing in my life, and so I just can't handle it. So I said, give the phone to the doctor. They were in the hospital. Give the phone to the doctor. So the doctor phone calls, the doctor picks up the phone, and the first thing that he said, hello, आप मम्मी हो इनके? I said, हाँ. आप डॉक्टर हो? ऐसे हाँ. डॉक्टर, इनका तो बहुत ब्लीडिंग हो रहा है, इनका तो सर्वाइवल का चांसेस बहुत कम है. So I said, that is the beginning sentence that I started this journey with. Imagine sitting in Mumbai, he is in Rohtak, which is Haryana, and I have to listen to this, that इसका तो बचने का chances बहुत, survive करने का chances बहुत कम है. The first thing came out of my mind. Now, I didn't think about it, but the first sentence that came out of my mouth is, survive कराने के लिए क्या करना पड़ेगा? So he said, we have to slit his trachea, we have to put it, because the entire face is jammed, so there's no airway for him, and we have to slit the trachea and put the tube. I said, कर दो. So then and I gave the phone to my husband and I said, we have to arrange to go there. And then my husband came running in that, the friends are saying that let him be pushed to a government hospital, because they are, the hospital that he was in is not going to take a chance. I said, they might be incompetent. So please take him to the government center, because in emergencies, the government centers are the best people that they can handle emergencies. So I said, just let them take him to the PGI Rohtak. And I started doing what I can do to get the best care for him at Rohtak. So what I did was, I wrote a message that my son has been severely injured. I need help. In all the groups that I have, in all the gynec groups that I have, you people must have been part of different WhatsApp groups. I never I would put WhatsApp groups in archives, because there were so many groups. But that day, those 5-6 WhatsApp groups changed the entire situation. There were phone calls, there were help. There was one couple who I didn't know, and the person who knew them also I didn't know. That couple went to the hospital to see, and it was a very foggy day. So he had a bike accident because he couldn't see anything. He was speeding and he sped on a bumper, and he flew with the bike somewhere and he fell on his face. So the couple went to that hospital, and the first call from a doctor, मैडम मैं आपके बेटे के साथ हूँ, आपका बेटा अलाइव है, जिंदा है, हाथ पैर भी हिला रहा है. So this is the first thing that I got from a doctor, that he is alive and he is moving his hands and legs. So one good bright thing. So then there were calls, by the time I called up the critical head in ICU in Rohtak, he was saying, now the mother calls. I have got 5 calls before this, madam. You must be a very important person. I am not an important person. I just had friends. I just had colleagues. I just had mothers, parents who resonated with what I had. And everyone helped. So there was, of course, then we went to Rohtak almost 13 hours after I got the news. I don't know how did I survive those 13 hours. I went there, we took very, very critical decisions of, the doctors helped us take care of the decision that we have done this. The ICU where we were entering, in government places, what can you do about them? The gowns that in ICU, it's a very sterile environment, the infection control has to be extremely strict in ICU. So that's why we restrict visitors, we give them gowns. So there was a place where they would wear that gown, go to the ICU, come out and leave their gown there, because those gowns will go for washing. So I could see the village people wearing that gown, going into that ICU, coming back and again opening the gown where the gowns were kept to wear it. They didn't know, and there was no one to guide them. So imagine the kind of infection control there. And I had my son over there, completely unconscious, hands tied, and I was, intently looking for somewhere the feet is moving, and some doctors were saying that his hands are not moving, and I told them to open the ties and let me see, and I was calling him. He was like completely nothing there, but still, they said that the doctors said we have done our bit, now you take him to a higher center. So while we were taking him to Medanta, I still remember that road journey. I was in the ambulance with him, and the roads are Indian roads and ambulance. So first of all, there's a lot of fog. It was January. And then every time the ambulance would bump, his tube from the trachea, from where that ventilator tube was attached, would come out. And then he would go into a sort of gasping mode. And then I just called my God, whoever. I took his name, and then me and the other doctor were putting the tube back again. This was going on for almost 3 hours. By the time we reached the hospital, his neck was so swollen that the tube had to be changed. This tube, because the tube was sinking in. So they immediately changed the tube, and then of course he was on ventilator. Then we took critical decisions of bringing him here, because they were, they were ready to operate on him. He was so critical, but getting him operated over there means I have to go to Delhi Medanta every now and then, because this was a journey. His spine was broken, his face is shattered, like bones were, like nose was in pieces, like micro pieces. His eye was on the here, like floor here. So everything looked so aghast, but still I could take the decisions, the right decisions at the right time, because I had friends. I had that support. You know, the hospital CEO called me, you don't have to think about anything. You just bring him here. The director, the medical director, bring our son home. This was his words. My friends waited. I mean, I was almost getting him operated over there when my friends called me up early in the morning to tell me that, think about it. This is not what you will have in a control. Somehow bring him here. We will take care of everything. And the entire team was ready to take care of my son. We air ambulanced him. He came here, and of course, almost 2 months of intensive therapy, ventilation, many surgeries. Like the first surgery went on for 17 hours, but still I had friends coming down. I had my family. My sister came back from US. My friends from Kolkata would come, spend 2 days with me, go back. Then my husband's friend would come. My school friends who are here would sit down in the lobby for hours, knowing that I'm not going to come down, And I continued my work, because work gave me that solace. I called all my patients in that hospital only. And I said that, he also, because it took about 7 days for him to gain consciousness. And after this, once he's, gained consciousness, and once he understood what's going on, fathomed the whole idea and thought, and made peace with that fact that he has to lie down and he cannot get up, and he has to have his tubes around, and he cannot breathe on his own. He has to breathe through a mechanical ventilation. All that took almost about 10 days, and after 10 days, once I settled him, I started work also, because work gave me a distraction. Work gave me a piece of my mind where I could think about something which was also different from my son. And I had a commitment also. So, and of course now it has been 2 years. He has almost fully recovered. Face is not the same anymore, but he's so used to with that, like his implants are still has to be in place, and he often tells me that I've got so used to eating without my teeth. Mama, I think with the teeth I will not find it so easy. So he has again joined XLRI through an exam, and he's doing his MBA. He's also doing his MBA on a hybrid basis, because he still has to go through hospitals, still has to go through procedures. The last procedure was in January, and he still has to go through multiple surgeries. But he was now he's back to his normal self. So I call it a God. I don't know who was holding my hand and helping me to take that decision. So whoever you believe in, maybe it's somewhere a power where you have no control on. Somewhere you have to believe in some power. Maybe you might be an atheist, you might not believe in God, but there is some power which is completely controlling your situations, and you have to face situations in life where you will have no control. And there, a supreme submission at least helped me, and I think every individual going through that crisis, this supreme submission helps. The second thing is goodwill. Happiness, smile, helping each other creates that goodwill, that at any point of time when you are in crisis, there will be people who are. Not that I'm not talking about, I have heard comments from colleagues that ये तो कितना बिजी रहता है, बट बाइक क्यों दिया था बच्चे को, जब मेरा बच्चे का बाइक नहीं था, इट वॉज समबडी एल्सेस बाइक, बच्चे को बाइक क्यों दिया था, ये तो इतना बिजी रहता है, रहती है तो इसका ध्यान नहीं रखा होगा, बच्चा ऐसा ही है, यू नो. So, but there were very few compared to the number of people that jumped on to help me out, and without their help I wouldn't have seen my son alive when I went there. You know, it took just 10 minutes for the PG at Rohtak to put the tube, and the first mark of her saving was done. So all this is probably the goodwill that I have earned through my colleagues, through my work, through my kindness, probably the kind. I've always tried to be kind, and we have helped, as doctors we help a lot of families, maybe that the blessing from those families, knowingly or unknowingly, and of course the grit. Every one of our family, every one of our extended family and friends showed that grit. My son, my husband hates to come to the hospital, but he was there with me at every point, just supporting me. Whatever I said, whatever I took the decision, he has never uttered a word that is this the right decision, never gave a doubt in my mind. My 17-year-old daughter, at that point of time, she was 17, and when I was telling her that, it's a very odd sight for you to see your brother in that state. And he said that, Mama, he is my brother. I will see him wherever, in whatever. So she was there. Everyone that I encountered after that used to tell me that, Sudeshna, you're very strong. Well, I wish no mother, no parent should go through this. But that situation is somewhere you have to take a call. If you are not strong, you have two choices. In that situation, I could have just cry and let him die, or I could do all it takes to bring him back. So which I chose. And where, as I said, that when you take the first step, there is a force behind you which takes the next 4 steps. And that is exactly what happened. So summary of the 3 lessons, as I said, purpose. Your purpose changes the performance. Your inner commitment is the most powerful tool, and correcting yourself every time, committing to whatever you have chosen. You might not have big dreams. Everybody doesn't have big dreams. You might not think ahead 5 years down the line, but you can think about 1 week ahead of you. Targets, small targets to improve yourself, to make yourself a better human being. These exercises do matter when you face a crisis. Stay, learn. If you need to restart, restart. But learn from everybody, as I said. You can learn from, I learn from my juniors, and I still tell my juniors, I always tell my juniors that, my students, that whenever I ask them a question, they would say that, they try to think, and I said, do mistake. This is the place that you can do a mistake. Okay, you are bound to make mistakes, but do not repeat those mistakes. So you have to go on learning on yourself and from others, and maintain grace. This was one of my friends who told, when we were looking through all the pictures that we took during our son's crisis, So my friend commented that the smile never went away from your face. So I don't know how I had it, but I had it with a gratitude that everything that happened was happening because there was some good in it. And I was thanking every bit of the people, everything that happened around that. I was thanking every moment. That brought me the smile. That brought the smile in everybody's face. So whenever you are under pressure, handle it with grace. Shouting at it, throwing things off, not reacting to it in a way you can control it is not going to help any which ways. So every story that I spoke is of resilience, which is not the fear of falling, but to come back again with everything that whatever you have, and you will gain everything that you had or going to have in future. If you don't know how to stop, never stop. Thank you very much.
Investment in securities markets are subject to market risks. Read all related documents carefully before investing.